What if the dryness, strain, or fuzziness you feel in your vision isn't from screens at all, but from the way you slept last night and the night before?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster. Today we're examining how your nightly sleep acts as a repair window for your eyes, regulating pressure, stabilizing tears, clearing retinal waste, and coordinating immune defense. When that window gets cut short or pushed off schedule, tiny stresses don't clear. They stack up.
I'm Alara Sky. We're focusing on how circadian timing governs when your eye tissues restore themselves, why fragmented sleep and misaligned schedules quietly erode resilience, and how targeted sleep habits can reduce irritation, protect the optic nerve, and support long-term vision.
Sleep isn't passive rest for your eyes. It's an active maintenance program. Overnight, intraocular pressure follows a predictable rhythm linked to sleep stages. When sleep is stable, pressure fluctuations stay within range. When it's irregular, swings widen, and the optic nerve endures more mechanical stress over months and years.
The surface of your eye also depends on that nightly window. With lids closed, tear evaporation drops and your tear film can recover. Your nervous system shifts into repair mode, and immune activity favors cleanup over vigilance. If sleep is short or broken, secretion declines, chemistry shifts, and you feel the hallmarks of dry, irritated eyes the next day.
Your retina runs on clocks. Light-sensing cells generate debris every day, and specialized cells clear it at night. If circadian timing drifts, that cleanup mistimes, oxidative stress builds, and long-term risk rises. This is one reason consistent timing matters as much as the total hours you spend in bed.
Melatonin is central here. It's more than a sleep signal. It helps lower eye pressure, limits oxidative damage, and protects retinal and optic nerve cells. Late-night light suppresses melatonin, removing protection at the exact time your eyes expect it. Dimming after sunset isn't cosmetic. It's protective.
Circadian clocks sit inside the cornea, lens, retina, and ciliary body. Sleep synchronizes them, so cell division, antioxidant activity, and immune responses land on time. When sleep timing shifts, repairs become mistimed and recovery slows. That's why people who keep changing schedules feel more strain, even if their total sleep doesn't drop much.
Low-grade inflammation is another consequence of poor sleep. Deprivation raises inflammatory signaling in eye tissues. Unlike skin, where minor irritation can resolve quickly, corneal and retinal structures tolerate chronic inflammation poorly, leading to scar-like changes, reduced transparency, and gradual loss of sensitive nerve cells.
Not all disruptions act the same way. Fragmented sleep, waking repeatedly, hits tear stability hardest, leading to next-day dryness and irritation. Circadian misalignment, sleeping at the wrong time, creates bigger shifts in eye pressure regulation and retinal function. Two people can feel tired eyes for different biological reasons.
Breathing issues at night add another layer. Obstructive sleep apnea fragments sleep and reduces oxygen delivery. That combination raises risk for floppy eyelid syndrome, retinal blood vessel changes, diabetic macular edema in susceptible individuals, and a sudden optic nerve event called non-arteritic anterior ischemic optic neuropathy. Early changes can appear years before a formal diagnosis.
Small but measurable thinning of the retinal nerve fiber layer, on the order of a few microns, has been reported in people with sleep apnea compared with those without it. That may sound minimal, but even subtle thinning can predict later vision loss. Addressing sleep-disordered breathing early protects function you can't regain once it's lost.
Treatment choices for apnea require nuance. Continuous positive airway pressure helps breathing but doesn't fix the airway's underlying stability. It can raise eye pressure and irritate eyes if the mask leaks. A proper mask fit matters, and any eye discomfort or pressure symptoms deserve mention at your eye exam so measurements can be monitored.
There are alternatives and adjuncts. Mandibular advancement devices gently shift the lower jaw forward during sleep to reduce airway collapse. For some people, This reduces interruptions without adding airflow toward the eyes. Your sleep clinician can help determine fit and follow-up, so benefits are maintained.
You can also modify the factors that worsen airway collapse. Breathing through your nose instead of your mouth supports oxygen delivery and airway stability. Excess weight around the neck and upper airway increases tissue pressure. Even modest fat loss improves apnea severity. Alcohol and smoking relax and inflame tissues, making collapse more likely, so avoiding them at night is a protective step.
Sleep position is practical and immediate. Back sleeping allows the tongue and soft palate to drop backward. Side sleeping, stomach sleeping, or elevating your upper body helps keep airflow open. These changes don't replace clinical care, but they reduce stressors that would otherwise show up in your eyes.
Now to concrete sleep strategies that support your eyes. First, lock in a consistent schedule. Go to bed and wake up within the same 30 to 60 minutes daily, weekends included. Predictable timing stabilizes fluid dynamics in the eye and keeps pressure rhythms from drifting.
Second, protect melatonin by controlling light after sunset. Dim overheads and limit bright screens close to bedtime. You're not only helping yourself fall asleep, you're supporting pressure control, lowering oxidative stress, and safeguarding retinal and optic nerve cells during the repair window.
Third, prioritize deep, uninterrupted sleep over just more hours in bed. Retinal waste clears, tear chemistry resets, and inflammatory tone eases most effectively during consolidated sleep. Make the room dark, cool, and quiet. Reduce awakenings so tissues complete the cycle instead of stopping mid-repair.
Fourth, use morning light to reset your eye clocks. Get outside soon after waking for 10 to 20 minutes. When natural light isn't accessible, a 10,000 lux light box positioned about 16 to 24 inches from your face for 20 to 30 minutes provides a similar daytime anchor. Typical indoor bulbs are too dim to do this job.
Fifth, address airway health at the root. Favor nasal breathing, reduce excess weight if present, avoid alcohol and smoking at night, and choose a sleep position that limits collapse. Orofacial myofunctional therapy, targeted exercises for the tongue, mouth, face, and throat, can improve muscle tone and tongue posture, supporting nasal breathing and reducing interruptions in mild to moderate cases.
Know the warning signs that justify a sleep study: loud snoring, gasping awake, morning headaches, and daytime sleepiness despite sufficient time in bed. If you notice unexplained eye pressure changes, sudden vision loss, or chronic dry eye that doesn't respond to treatment, a sleep evaluation may be an essential next step.
Here's today's challenge. For the next 7 nights, keep your sleep and wake times within a 60-minute window, dim lights for the final hour before bed, and get 10 to 20 minutes of outdoor light within an hour of waking. If you snore loudly, gasp at night, or wake with headaches, schedule a sleep evaluation. Notice how your eyes feel at the end of the week. Less dryness, less strain, steadier clarity.
Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.